Welcome. Oh, I feel very professional now. Okay, thank you very much for coming to this session. We're very excited about it, and it's an area that we've been working on with the Victorian Women's Network for a long time. I'm Shelley Anderson, so I manage Alfred Psychiatry, Workforce Development and Education, and I'm also very privileged to sit on the Victorian Women's Health Network Community of Management. So that's a bit of a mouthful. But we're going to have an informal, relaxed session today. So it's not going to be, we don't even have any PowerPoints for the first presentation. And then after that, we're going to have Ray come along and I'll introduce her and we'll have another session. And then we'll have some questions at the end. So sit back, but also we'll ask for your participation and get you into groups because we find often people want to share their knowledge and skills. So without further ado, if Julie Dempsey would like to stand up, I'll introduce Julie. So Julie will give you a bit of a bio about herself, and then we've got Sandy Jeffs. And yes, give it up for Robin Minty. Excellent. So I'll hand the speaker over to Julie first, if she'd like to come and have a chat. Oh, Robin, sorry. Robin's going to talk a little bit about, give you some context about the network. Thanks.
I'm trying to keep away from everyone because I've got a cold. Yeah, it's going around. How many cycles have we had? Goodness me. So I apologise for any... just get my water out. Such a nursey thing to do, isn't it? Yes, I'm the acting vice chair for the Committee of Management for Women's Mental Health Network. I'm just going to do a little bit of an introduction about who we are. And then I'm going to hand it over to Julie, who's our chair, and she's going to be speaking to you from the consumer lived experience. The Women's Mental Health Network Victoria is a network of women consumers, carers, health professionals, and women who are interested in women's mental health. The focus of our work is to support women in the mental health system by highlighting the gender-sensitive practice that takes into account the lived experiences of women as they interact with the system at any stage. What we do, well, we advocate, we research, we train workforce, we support, and we empower women's lived experience through our network and challenge for change at a systems level. In a nutshell, who we are and what we do is about commitment to women and to the gender space, to advocacy, and we hope to take action as much as we can. Although I might preamble that by saying that we're largely a voluntary organisation. We have one part-time executive officer 3 days a week, and the rest of our team are all voluntary. We actually are a charitable association registered and run by volunteers, as I've said, but we do and have for 27 years been a powerful influence in the mental health sector. We've worked tirelessly for positive change in the experience of female psychiatric patients when assessing mental health services. We aim to embed a culture of safe, gender-sensitive care in staff practice, promoting a healing environment for women consumers. The network has been a front runner in a co-design and co-production of projects involving consumers, carers and service providers from its very establishment years in 1988. Key to the success and collaborative nature of the network is this combination of consumers, carers and professionals working together to promote awareness of issues that impact on women's mental health. Central to the network is the recognition of consumers' lived experience and their expertise and ability to partner in their own recovery. Thus today, we want to share with you how consumers and workers are working together, especially in the context about women's experience of hospitals. Consumers, carers, workers and network members have been empowered through the network's activities, effective lobbying and rights work. The network's list of achievements is interlinked with the lives of women with mental illness. By highlighting the experience and needs of women through effective campaigns in the past, say the last 2 elections, and working in partnership with women's organisations and organisations government-based, we've been instrumental in bringing about changes in the delivery and structure of mental health services. You may be aware of some of our work. A catalyst for change, some of the examples of that, would be our gender-sensitive training. And recently we have trained over 600 mental health staff across the state in collaboration with the psych nurses department. We've also seen $20,000 for gender-sensitive grants to 26 inpatient units. We've also been very involved with presenting papers at a state, national and international level. We've seen over time the establishment of women-only corridors, which has been one of our advocacy points, some with swipe cards, and at a minimum women-only spaces in all inpatient psychiatric units in Victoria. We've also been involved with the Chief Psychiatrist and the development of guidelines and service guidelines to promote sexual safety in mental health services. They were published in 2009. And we've also been integral to the development of service guidelines on gender sensitivity and safety, promoting a holistic approach to wellbeing, and those guidelines were published in July 2011. We've also participated and supported decision making along the way, and one of the celebration points was seeing $6 million in gender sensitive safe capital works grants across the state in recent years. And I guess that brings us to today's event. We're going to be sharing with you a snapshot from our Building Gender Sensitive and Safe Practice Training Manual, and just talking a little bit about the program across this space today. And we now know that it's incorporated across all Victorian acute psychiatric inpatient units, and we're hoping in the next 12 months to implement the training across the AOD space and the community mental health sector. So that's, we're now licensed to do that. So it's going to be one of our big challenges for next year. An aside, but still important, is the way we've conducted our networking into the consumer lived experience space. In 2006, the network conducted a survey. You may not be aware of it. It was a small survey of 75 women consumers' experiences of hospital care. And during that survey, we found that nearly half felt unsafe, and that 61% experienced harassment and abuse directly in the hospital system. Of the 42 mental health staff surveyed, we also had reports of 70% experiencing, the staff we surveyed reported that they had seen abuse and harassment occurring in their inpatient wards. We are now conducting a public opinion survey again to that effect, to see what's changed in the sector in the last 10 years. We're hoping that it will have shifted. We'll let you know the results when we have them. When we do get those results, that qualitative survey will then report to it will help us report to governments and the broader mental health sector to highlight consumer experiences of inpatient care so that we can better inform service delivery. Today is your opportunity to engage with us in a non-judgmental environment as we seek to explore with you the gender-sensitive environments that we feel, as a network, will support women in the best possible way. That is what the network is about, bringing together the passion, expertise, innovation, hope and determination of consumers, workers and others to make a powerful voice for change. I'm going to hand now over to Julie Dempsey, our chair, who is going to share with you her lived experience. Julie has been our long-standing chair of the network and has worked tirelessly for women's rights to engage with the health system and feel heard, feel acknowledged and be safe. Thanks, Julie.
Thanks, Robin. Hi, everyone. So I'm going to talk to you today about some of my personal experiences of being in public psychiatric hospitals. Many issues arise from an admission to an acute public psychiatric facility, and often women must deal with confronting conditions just in order to receive treatment for their mental illness. I speak to you from the point of view of a consumer and a worker in the field as a consumer consultant at Forensic Care. I have been in the hospital system since 1982 with multiple admissions to Parkville Psychiatric Unit, Willsmere, Larundel and Broadmeadows Inpatient Unit. Although the size and programs of the hospitals change, the issues of safety for female patients in mixed wards to a large extent remains. It is only just recently that these issues are starting to be effectively addressed and need our constant attention not to slip back into Dickensian-style conditions. In summary, my experiences in acute settings over the years have included male patients walking naked into the day room from the shower, enduring unwanted verbal aggression from male patients. Examples of this are in the form of inappropriate sexual suggestions, insulting homophobic comments, physical and sexual threats or demands in relation to my body and private space, male patients walking uninvited into my bedroom at night, trying to get into bed with me, definitely uninvited, witnessing male and female patients engaging in sexual activities and intercourse when their decision-making capacity is affected by illness. When visiting friends in hospital, I have had to endure male patients exposing themselves or making lurid comments after I've left the premises. I no longer feel comfortable even visiting someone in hospital, let alone voluntarily putting myself in as an inpatient to a public facility. At one time, I was sexually assaulted whilst an involuntary patient. Due to my confused and delusional thinking, I thought that by complying with the sexual demands of the male who assaulted me, I would be released from hospital. Even though I was severely distressed, I did not inform staff. Due to my paranoia, I thought they had instigated the encounter on purpose to test my sexuality. These situations are not rare and can affect female patients' mental health long after they have left hospital. I also had two friends who were sexually assaulted while in hospital. One friend suicided and the other became pregnant as a result of the assault. All of these things have happened over the years, many of which were still current, as illustrated by my last hospital stay in 2008. A common problem that was still evident concerned one male patient hitting on vulnerable and confused female patients. So at one point I told him not to take advantage of them. His response was to call me a fat pig with men's balls. When I asked him to move away, he called me a slut and many other unmentionable words, and then threatened to knock my block off. At this time, other female patients became concerned and moved over towards me. When the altercation was over, the other female patients talked to me, hugged me and gave me a shoulder massage to try and relax and reassure me. All this happened with a male staff member watching on. He only intervened when it looked definite I was about to be physically assaulted, but the nurse did not reprimand the male patient. Later, when the offender was out of earshot, the staff member congratulated me for sticking up for myself. What message is this sending to male patients who act inappropriately and in an aggressive manner, and to female patients that they should have to tolerate such behaviour? The staff had been told numerous times what was going on, but in my opinion, the other female patients did more to protect and support each other than the staff did. On the staff side, though, resources were tight and the HDU was full. But does this justify female patients being so exposed to such abusive men? Disrespectful behaviour should not occur in any part of society. I do not accept that this should be excused on the grounds of mental illness. In situations like the above, a code of conduct would be useful for both patients and staff alike. By clearly outlining appropriate and acceptable behaviour, a standard of what will be tolerated can be set, so as to reassure vulnerable consumers that they are in a decent and secure environment. Without strong leadership and clear policies, staff can also feel unsupported and intimidated, resulting in inaction. Often it is too easy to see problems that then put the effort into solutions. Many times when reasonable suggestions are made, the system is so rigid that we forget how to be human. It is people who change the situation. I'm asking you to change this situation. Mental health workers are not horrible people, but the system as a whole can be very demeaning for female patients. Training in dealing with sexual and abuse issues would be a good start. Many times when an incident arises, staff may be reluctant to tackle the fallout with affected patients. When disclosing my history of past abuse, I have been met with a range of responses, varying from ridicule to straight-out silence, like I was invisible and had said nothing of significance at all. Distressed consumers need support and compassion, not disbelief. Although such scars are rarely addressed during a hospital admission, insensitive trauma handling can result in it being compounded rather than reduced. Staff cannot be expected to solve all of a patient's pre-existing problems, especially in such short-term environments. However, showing some basic compassion can go a long way to making a vulnerable patient feel more secure and heard. We need to keep raising the issues of women's experiences. It is not enough to hope for change. You have to believe it can happen and work collaboratively to make it happen. Being involved with the Women's Network has shown me how outrage can be changed into positive determination for a better outcome for women's psychiatric patients. Title of this comic I've done, which addresses the issues we lobby for and gives a history of the network, so they're free on the table at the end of the session. Hospitals should be about refuge and recovery from mental trauma. What consumers need is a supportive framework and staff that encourage and enhance the development of skills and expertise in identifying and acknowledging and addressing safety and trauma issues. So for any staff here today, please take your own steps as individuals and as a team to help empower consumers with the respect and self-worth they deserve. For consumers, we likely all share some form of trauma. Let's share together in the solutions. Be strong, be brave, and be heard. Thank you.
I've known Julie for a while now. She never ceases to amaze me with her strength and sharing that story. So thank you very much. And I'm also very conscious it's pretty full-on stuff in some ways. So be kind to yourself. I'll hang around if anyone wants to come and talk to me. I don't know if I can help, but, you know, I'm here. And just to sort of, if we can just, look after each other, that would be really nice. And thank you very much, Julie. So just about the network, the training. So we were very lucky. We worked with the Department of, I can't even remember what it was back then. It's changed a few times, Department of Mental Health, and we continue to, and we're going to, and I'm picking on Nicole there because I know she's in the department now. We've been working with them. I'm going to sort of try and roll out the training that we were alluded to. Now, the training is really important stuff, and I know it's not going to sort of potentially, you know, it's not a magic solution, but it is a conversation starter and raising awareness and does get people to think about things. And one of the things with that, we worked with men and the LGBTQ community, so it's been really, it's been exciting, and it's sort of, you know, we've learnt along the way. So, and we keep enriching out and trying to develop it. So that's something that, if you want some information about it, please feel free to contact the network. I am going to make opportunity here, because the survey that Robin talked about, we're going to send out to the participants today. So if you wanted to, or if you've got any consumers or friends or anything, that we can sort of get that information, because that helps. We need the evidence, you know, to help us move forward in some way. So stay tuned for that survey. Excellent. See, Julie's onto it. We've got some copies here. We've got some membership copies, which is free membership. But I'm just conscious of the time, and we want to get started and moving. So Robin's going to come back, and we're going to do a bit of group work. But she'll read out a case study, then we'll break you into groups. So that'll be great. So thanks, Robin.
Great. We do have the service guideline here. It's very hard to find online. Or more particularly the gender and diversity lens for health and human services guidelines as well. I think they've almost probably been lost in the cyber space of all the changes between governments. But these two guidelines, they're a little bit out of date, but they still stand as the platform that we promote the gender-sensitive safe practice for all sector members. And the training was actually developed in and around the many, I think there's 8 pillars for gender-sensitive safe practice. We haven't touched on trauma-informed care, but that is one of the key platforms for a lot of our work, given that we're talking about what's different for gender, and given family violence experiences and other trauma experiences, we've found that women particularly have that vulnerability to re-traumatisation in their hospital and recovery experiences as well. So that's why we highlight that training and supporting the mental health sector is so important, to encourage incoming new staff, graduates, and ongoing policy development, and of course the implementation plan that the psychiatry inpatient sector already has, in terms of supporting the ongoing training and promotion of reflection, if you like, that we as workers need to seek of ourselves along the journey of how we support consumers in their recovery. The training itself has 3 modules, and we're not going to do the training today. It can take up to 2 days, given some organisations decide to pop it into their ongoing 12-month annual training schedules. But the three areas are around communication and what is gender, and you know the reflection that staff and consumers can deliberate on. We're going to give you a snapshot of that today as part of an activity. And as Shelley said, we're going to break up into little groups if we can. I've got a handout, but I thought I'd just read the case study that we're going to talk through today, just to set the scene. There's a number of questions. When you meet with your group, just choose 1 or 2 and talk them through, and then we'll bring you back to the main group and we'll have a bit of a chat. And then that will conclude the main formal part of our presentation. So a new client, if you can imagine this, I'm not sure what part of the sector you actually come from, but if you can imagine a new client accesses your inpatient residential unit or service, you know from the consumer's record that they have a past history of being physically and sexually abused. The majority of consumers at your service are male. At times, they can be quite verbally aggressive towards each other, as well as other consumers and staff. The new client appears very anxious and stays very close to where the staff are located. Now, we want you to imagine that the client is female. And then, once you go through a couple of those questions, we want you to imagine that the client is male. And then we want you to imagine that the client is transgender, male to female. And if we have time, or just pick 1 or 2 of these, transgender, female to male, and even intersex. So that covers off on some of the diversity of gender that might present to you in this context. These questions will guide you a little bit, and I would propose that we group the groups sort of more naturally as they occur in the room. Maybe 3 or 4 of you, or 4 or 5 of you at the max, just so you can have a proper conversation about the questions. Thank you.